Seasonal affective disorder is actually a subtype of clinical depression. So there are some very specific aspects of seasonal affective depression, but essentially it is depression, and so it has all of the hallmarks of a depressive illness. The main difference is that there is a seasonal component, and it typically starts around October, November, so it would start when the fall starts and when the days get shorter, and typically it ends by early spring when the days get longer. We don't know exactly what causes seasonal affective disorder. We do believe it has to do with the length of the day and the exposure to sunlight, but there's no specific scientific evidence that ties it to any one thing. We know it isn't specifically related to cold weather. It's not related specifically to the holidays or the time of the year per se, but we do know that seasonal affective disorder increases in frequency as we go north. So we have about a 1% of the population in the United States suffer with seasonal affective disorder, but about 2 to 3% in Canada. So we know as you go further away from the equator, the percentage of people who suffer with it does increase. So the population base for seasonal affective disorder is similar to the same demography of depression. So it will affect women about 2 or 4 times more often than men, similar to depression. And interestingly, it does increase as people get older, but it seems to drop off precipitously around the age of 60. So as compared to regular depression, depression does get more frequent as people get older, but seasonal affective disorder tends to increase as people get older, but then it drops off after the age of 60. Seasonal affective disorder seems to have some unusual features, and one of them is that instead of losing appetite, which is typical of depression, people with SAD or seasonal affective disorder actually have an increase in appetite and actually an average of a 20-pound weight gain during the wintertime. So that's one significant difference. The other difference is that people with regular depression typically have insomnia or trouble sleeping, whereas people with SAD actually have an increased incidence of sleep and actually add about 2 hours of sleep per night during the season. In terms of what people should be looking for, we would be looking for a change in behavior and mood starting in the fall, so starting essentially in October, November, with perhaps withdrawal from friends, decrease in interest, more irritability or anger, perhaps tearfulness, anxiety, agitation, any one of the symptoms of depression. But we'd be noticing it mostly starting as the days get shorter, and we'd be seeing routinely it improving, usually by April, but by early spring, an improvement in that, and that would be what the individual or the family would be looking for.